Private equity firms are not healthcare firms. They're in for making money. Clinic is all about seeing more patients, seeing more patients, seeing more. It's like, well, this clinic down the street is seeing 30 patients a day.
We need to start really piercing that veil and exposing who are these decision makers. Did I say the quiet out loud?
I have heard that, even some organizations give incentives to their providers to see more patients.
Yes, they do.
Not incentives for getting great care, for keeping your patients healthy.
What happens is that healthcare workers get all the flack because people don't understand that we are no longer the decision makers.
Right. Their goal is to make money. Their goal is not to care for the people. If you work in maternal health, right, that they're closing down labor and delivery units all over the place. Why? Because it doesn't make any money. You should not be able to profit off of my death and off of me being sick.
You have to help me and support me in this situation because I'm so pissed off. While some are already talking about the impact of private equity firms on the real estate market, it is time to talk about how disastrous they are in healthcare.
Between 2010 and 2021, Steward bought up more than 30 hospitals across 9 states. Private equity-backed companies like Steward have sold off hospital real estate, and instead of putting that money back into care, they've pocketed a large chunk of it.
They are killing our patients.
Today on Capitol Hill, medical workers and local government officials testified about the damage done by the company, which declared bankruptcy earlier this year.
Steward didn't pay the vendor and there weren't any bereavement boxes. And nurses were forced to put babies' remains in cardboard shipping boxes. These nurses put their own money together and went to Amazon.
Missing at the hearing, Dr. De La Torre himself, who requested his testimony be postponed after he received a subpoena.
Dr. De La Torre is a coward.
Thank you for watching and click subscribe. So most people don't even realize who's really behind the veil of healthcare. And who's behind the veil of healthcare is really who makes all the major decisions, down to what medication is available for you, whether or not supplies are available for your procedure in the hospital. And it'll be surprising to many people to find out just who are making those decisions and the fact that they don't even have degrees or expertise in healthcare, but may just be trying to make a quick dollar. Sad thing is, this results in complication rates being higher and has resulted in deaths. So who are these players? It's going to surprise you.
In Boston last October, a new mother died after a medical device that might have saved her life was repossessed weeks earlier because Steward hadn't paid its bills.
My eyes are so opened after hearing about this unfortunate case of this Bostonian mom who had what seemed like an every normal delivery, but so was the case in the US, delivered and then had this complication that led to active bleeding of her liver. Now, that active bleeding of her liver could have been treated potentially by doing an embolization procedure. So an embolization procedure, for those who may be wondering what exactly is that, it's a procedure where you basically catheterize to the artery or that is feeding potentially this bleed. And you place in there pellets that will clot out the major feeding blood vessel to the bleeding area. And that subsequently will ideally, in some cases, not all, but lead to either a significant decrease in the bleeding or in some cases, a complete cessation of the bleeding. This particular hospital, which is Elizabeth's Medical Center, was previously or recently prior to this situation purchased by a private equity group called Steward Healthcare. Apparently they didn't pay their bills. Y'all have a lot to be talking about minoritized groups, but y'all out here not paying bills either. They didn't pay their bills, and not paying their bills led to a supply shortage of a coil that was necessary to perform this procedure. She ended up having to be transferred to another hospital, and subsequently, just an hour after that, had a massive heart attack and died. And the heart attack could have been related to the significant hypovolemia as a result of the bleeding. And so this kind of opened the can of worms. What exactly is going on?
Steward Healthcare systematically extracted every possible dollar that they could get out of our hospital until it led to its closure 12 days ago.
Well, we got a lot to say about this. Listen, Olivia, you have to help me and support me in this situation because I'm so pissed off.
I mean, the terminology is confusing. So private equity firms, I think when people say, take money out of politics, take money out of healthcare, they're talking about this. They're talking about parties or people or companies or organizations that are invested but have nothing to do with the well-being of the people or of the industry that they're in. So when we're talking about healthcare, private equity firms are not healthcare firms. They're in for making money. And what they do is they buy, basically, they leverage the hospitals and the things they buy with debt, but they don't settle their own company with debt. They settle the company that they bought with debt. So St. Mary's Hospital, they settled St. Mary's Hospital with debt. Then what they start doing is they start selling off pieces of the land. They bring down staffing. They do all of these things to cut costs and improve and get higher profits. So what they do is they're usually invested in for only like 5 to 8 years. They basically suck the money out of the business. That's their goal. Their goal is to make money. It's not to make people do better. It's not for community's sake. It's nothing. And it has gone up something like an insane amount of money, like $1 trillion of private equity money is now in healthcare and things like that.
That's
So
crazy.
after they bankrupt it, then they're out and their shareholders have made tons of money. Communities have lost the healthcare. People have died. And so when people think that privatization is good, I know a lot of people who think that, you want the private sector to oversee hospitals because the private sector, like Amazon and Google, they know how to run businesses. They know how to make money, right? Their goal is to make money. Their goal is not to care for the people.
Right.
So this is why money in healthcare, this is why privatized healthcare like this is dangerous. It's because it's not about the people. It's about how much money you can make. And you can stay with doing a lot. And that's why they weren't paying their bills, because they were like, guess what? We're not paying nothing. And then when you go bankrupt.
What would you have done with the $40 million?
We'd have beds for patients. We'd have stretchers. We'd have food, diapers, staff. All roads lead to staffing.
For that particular hospital, St. Elizabeth's Medical Center in Boston, shout out to the staff, because what happened was the staff actually filed their own complaint. Right. And that's what we talk about when we talk about health advocacy. Like sometimes health advocacy is not just advocating for the patient in the operating room or in the exam room, but it's also advocating on a structural level, on an organizational level, on a governmental, on a civic level, right? CBS did their own investigation and they found for this particular Steward company a trail of unpaid bills in multiple hospitals, including basic things like tubing for respiratory masks. They have just a ridiculous amount of outstanding balances, while at the same time, to your point, they were making these investments to suck out the equity, and then making these hospitals and other types of healthcare practices, it's not just hospitals, vulnerable and making them unsafe. They sold an equivalent of $1 billion worth of real estate of the hospital. And they had been selling out the real estate for the hospital systems since 2016. By 2021, their owners paid themselves millions in dividends.
We found evidence of lavish spending, including this $7 million Texas horse ranch Dr. De La Torre purchased in 2022, 2 corporate jets, and this yacht valued at an estimated $40 million.
Millions. CEO having I think it was like a $40 million yacht, while people are out here dying. I mean, it's just so unethical on so many levels. And to what Governor Healy did in Boston was that she dispatched these state monitors, because now they have to internally monitor these healthcare systems to make sure that patients' lives are not being placed at risk so that somebody could make an extra dollar. This has led to national studies now looking at the impact of private equity. And the studies have shown that there are increased rates of complications, especially looking at falls and infections. The rates are so much higher, and the falls are probably happening, to your point, because there's such decreased staffing that there is no one to really watch people who are at risk, like the elderly, for having falls. There's more post-surgical adverse events as well. So the question is, where are we going and how do we stop this ship? Because
I hate to always go to like the spiritual, bigger,
we do have to go there because this is straight evil.
But because it's like, I feel like until as a people, especially in this country, in the United States, until we stop thinking that money is the end all be all, that capitalism is the end all be all, that we should all strive to be individualism, that we should all strive as to like, I'm the big dog and it doesn't matter who I have to step on to get there. Until money is not like we're going to continue making decisions, poor decisions, because they're driven by faulty logic. I mean, it's about money. And when you tell people that, they're like, they don't quite understand, but this is what it means. It means if it's about making money, anything goes. The means justify the ends, right?
Right.
It doesn't really matter. So I kind of feel like until people understand that you don't want, especially in places like education, places like healthcare, even in politics, until you understand that you don't want people who have nothing to do with what's going on and they don't really want the best for you, all they want is money, then it's not going to change because it keeps doing the same. But on a smaller level, obviously policy work, looking at this, actually becoming aware, because I would say anybody who's been in healthcare in the last 20 years knows that this is a problem, whether it's private equity firms or these big health systems that are buying everything out, or just the fact that it's privatized. You know this. You know if you work in an emergency room, you know if you work in maternal health, right? You know that they're closing down labor and delivery units all over the place. Why? Because it doesn't make any money. Right? You know that all these places are understaffed. Why? Because they don't want to pay. They'd rather have travel nurses. You know, it's all about money. And for those of us who are in it, we know that. And we know what that looks like in day to day. And this is what it looks like. It looks like you said. I don't know if you ever saw an episode on Grey's Anatomy where they chose a different kind of surgical mask. The cheaper one that they were forced into using it. And because they use it, it was gloves or something. And the gloves had microscopic holes. And so this crazy hospital nosocomial infection started killing people. And then they were looking and they were trying to figure out what happened. And they were saying that they weren't washing their hands when they were going into the OR. And what it was that they picked the cheapest gloves, sterile surgical gloves. So all these patients were getting infected and dying. And so that is an example of how, if it's for
Clearly, I'm not up on Grey's Anatomy.
It's an old episode, but it's just a really good example, a small
It
example of if it's about the money, the hospital and the people at the top and your C-suite people want to make more money. So they're going to cut costs to make everything cheaper. And that's one example of what that's like.
And they're tasked with that, right? By these equity firms, they're tasked with having to do that. So sometimes I think what happens is that healthcare workers get all the flack because people don't understand that we are no longer the decision makers. They don't understand that we're not at the top. We're just following guidelines and instructions. And this doesn't just affect hospitals. They are purchasing up clinical practices. They're purchasing up ambulatory surgery centers. They're purchasing nursing homes. So when you wonder why the nursing home is understaffed during a pandemic and can't care adequately for your loved ones, then look underneath the veil. And I think if nothing else, we need to start really piercing that veil and exposing who are these decision makers. And I think that's part of the issue is that the public in general, I mean, we hear about these stories, but we don't really know when we are going to a hospital, who are the decision makers in that hospital. And it's so important to know that because we investigate our lookup into banks, like what is their fees and what are their policies.
You should know, everybody, newsflash, hospitals, the ones who make the decisions are the presidents, the CEO, the C-suite. They're the ones who they're the ones. And then everybody else has to fight back and push back and be like, you can't, that's crazy. Those are the ones.
Right. Because some of us still believe in that human lives are not worth money or invaluable.
Or because it doesn't make sense. That's not medically sound. That doesn't make sense to practice that way. That doesn't put the patient first. That's why most of the time it doesn't make sense. You keep trying to proceduralize everything. And if one thing worked for everybody, then everybody, it would be easy.
They would be easy.
You wouldn't need all the schooling you have, right?
Right. And it's not to say that they're even considering the science, right? Because, you may not necessarily understand everything, but you could investigate. You could hire advisors who could actually give you some advice about the science, but they're not even doing that. There's no input.
Well, they said, I can't remember the exact decade, so don't quote me, but at some point in the recent history, let's say at least since the 90s or 80s, let's say maybe, that is actually what happened. These firms went into hospitals and clinics and stuff, and they kind of pitched it like, we are going to teach you how to run this like a business. because there is big money here, there's big business here. And so that's what started happening to healthcare. Like, it was a significant shift, because a lot of people don't know this, but hospitals are supposed to be actual nonprofit institutions.
Yes.
And nonprofit institutions are supposed to be for the community, right? They're to actually,
Right.
the nonprofit status means that money is supposed to go back into it and back into the community, because you're supposed to be meeting the needs of the community. A lot of people don't know that. A lot of people don't know that they should expect that and demand that from their hospitals, that you're here to serve me, right?
Right.
So
But now with these equity firms, they're for profit. That's the problem.
Exactly. So at some point when it changed, maybe 80s, 90s, early 2000s, I want to say it was like the 80s where it really shifted to this serious for-profit system. And they structured almost all FQHCs, hospitals, like corporations. They have individual, you have the CEO, the president, the COO, and their responsibility is to answer to the board, right? And the board, why haven't we made more money? Why are we more profits? Why are we losing? That is what they care about.
What's interesting is that Steward Healthcare then started to blame the profit or the deficiency in the finances of the hospital on the low reimbursement from Medicare.
I mean, that is an issue.
I was about to say,
That is an issue.
it is an issue, but you
It's
can't
not
really
that
claim
easy.
that when you're also paying out dividends that are in the millions,
You're
right?
making
The
billions.
hospitals that aren't paying out that large amount to their shareholders or owners, they can use that excuse because the Medicare reimbursement is low and it is a problem. That is why, because you have to get to the point where, like,
criminally low.
yes,
Be real.
because I think we have to get to the crux of the problem. Like, why are they able to buy out hospitals? How do we get here, right? There was a shift, but what really caused the shift? Well, if you have low reimbursement rates, then practices cannot sustain themselves because you literally can't make the income to sustain the cost of the practice or to cover the cost of the practice,
Not
from your
if you
staffing
wanna-
to your supplies to your your overhead.
Not if
And
you
so,
want to care for people that need it, right? That's why a lot of midwives can't sustain their birth centers or home birth practices, because the people that you want to care for, the people who need your services, the people who don't have access to everything, usually are on Medi-Cal, Medicaid, Medicare, some other type of either state insurance or something like that, and it's unsustainable. It's unsustainable.
right, it is.
Can't
And the question is, because ultimately what you're going to end up needing is some type
socialized
of,
healthcare.
girl, you better not say that dirty word.
I know. But what does that actually mean? When people are so scared, what does that actually
People are so scared of it, they won't even care.
Medicare is the government, is it not?
It absolutely is.
Medi-Cal is the government, is it
But
not?
that's why certain groups want to get rid of Medicare.
Of course, but the
Yes.
people who benefit from it know that it's amazing and has worked, and it's not perfect. Nothing is perfect,
Right.
but it's solid and it takes care of the people. That is government. Hell, the post office is the government. It's socialized. I mean, I don't understand. You can have a public option, which taking it back is what Obama originally proposed, a public option that is run by the government.
Yeah.
And then you have private options, just like you have the post office, and if you hate it, you have FedEx if you want it.
Yeah.
Right?
Yeah.
You can have a whole array of things. And nothing is perfect, but this idea that because all the excuses that people make for why we can't change, to me, just further, I don't know, solidifies that we don't actually do the research. We don't actually understand what it is that we're saying. And perhaps people who are opponents to change don't actually understand the impact that it has on the ground.
Yeah.
It's for policies about women's healthcare bodies, about, women's healthcare in our bodies and babies and birth and things like this.
Mm-hmm.
You don't actually understand, and very few people actually go in and read or talk to people who do the work, so you can understand what your opinion actually is based on. Like, not just because you read it online or you went down a rabbit hole, but actually, like, ask people who have been affected or who work in this. And most of us who work in this, I believe, are on the same page that this system is hella broken.
Right.
It's getting tighter and it's feeling worse.
So some people are saying, to your point, I know socialized medicine is a dirty word in the United States right now. Half the population have gasped at the sound of
That's why I said it. We get pinged.
And so but to your point, is there a middle ground, right? Is there a middle ground between private equity and health equity? And some people will argue maybe it is possible to have some type of middle ground where there are policies, or as in the case of Boston, some type of monitoring system that monitors the outcomes and hold responsible these owners to make sure that there is not an impact on the lives of the patients. But the problem is they're not going to get the investment, the return on investment that they intended to get, right? Because it's going to cost healthcare costs. That's just, there's no other way around it. Healthcare costs, because there are other aspects that we should probably be talking about. We ain't got time to talk about today about why healthcare costs, right? These unregulated vendors, real estate, name it. Anything that deals with healthcare, the price tag goes up.
Yeah, like why did the coils cost so much that you were millions of dollars in debt?
Right. Exactly. Exactly. Right. Because that's ultimately what happens if we don't regulate these vendors.
And the insurance companies. It's the insurance companies.
And the insurance companies.
Honey, don't get me started on insurance.
I know. No, I can get you started because I'm already there. It's all these unregulated areas that lead to the difficulty in balancing and keeping hospitals out of the red. In matter of fact, most hospitals that are truly nonprofit, they operate in the red, consistently in the red, right? And so it's hard for me to imagine that we have a middle ground where private equity firms, because their purpose is to gain some type of financial benefit, some return on investment that makes it worthwhile to do their investment. They're not doing this philanthropically. They're not buying up hospital systems and clinics and offices philanthropically. It has nothing to do with preserving or helping the lives of people. Absolutely nothing. And so because we have a healthcare system that is so unregulated and so costly, it is hard to see that there would be a middle ground where they would then forego their potential investment from the real estate to improve the lives of individuals. And even though that is probably the most ethical and moral thing for them to do, they're not in it for morality, period.
But I think it's like you said, it's policy. It should just be illegal, Taska, because sending people to watch over, that's just a band-aid. Just stop. Like, I know a lot of people are like, no big government, let's not but there are certain things that have proven time and time again that if you don't regulate, they become unregulated. Because again, if the goal is to just make more money, people are going to do whatever it takes to make more money. It doesn't matter if we destroy the rainforest and our planet, it's money, money, money. Even though we can't eat it, we can't drink it, and we can't take it with us. So I don't understand. However, I digress. It's just policies. Private equity should not be able to get into medicine. It's not supposed to be about that. So it should be illegal. You cannot, because it shouldn't be about you just making money, 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 money. That's the problem. It should just be taken out. We should work on policy that really addresses the issues from the root. And therefore, you don't have to send state controllers and more people you're paying, and then healthcare costs go higher. It just shouldn't be that way.
Yeah.
Protect our people by saying healthcare is a basic human right, just like housing should be, and just like eating should be. It is a basic human right. And therefore, the government is going to offer something. And to be able to say that we cannot do it, to be able to say that we cannot find a middle ground, frankly, for the United States, that we pride ourselves on innovation, on being leaders, then seems a little bit ridiculous considering other developed nations have done it. And there are issues with it, and it's not perfect. I know people, some people love the Canadian system, some people love the European, like the UK and Germany and things, and others are like, oh my God, it's such a mess. However,
they were actually on strike when I was in England.
But still, you move forward. You have to have progress. You can't say, well, just because it's not perfect, this is clearly not working. People not getting things or crazy things because there's no money. That is not working.
Yeah. Also, when people are dying because there's a lack of supplies because of an unpaid bill, that should be a red flag.
Or women can't get care because now you have care deserts because there's nowhere to give birth. And then so you have to also look at the birth system and understanding, why are we birthing in the hospital when we can be birthing at home? I mean, there's so many layers to it. But I think a first step, an easy first step, is to understand that for-profit healthcare does not work. And the people who suffer are going to be us and our loved ones. It's that simple. You should not be able to profit off of my death and off of me being sick.
That part.
It's a bummer.
It's a bummer. It's a bummer, but I'm so glad that we're talking about these things because I don't think people really know that this is what is happening. I think people still think that most healthcare systems are nonprofit organizations. Even if they don't quite understand how nonprofit work, I think they think it's some type of philanthropic center where it no longer is and it hasn't been. And to the dismay of healthcare staff people, that's why I wanted to really highlight that the staff members actually filed their own complaint, because I think it's at the end of the day, we're the ones with patients. We're the ones caring for the patients. And we've had to become advocates, right? In addition to staying on top of the science and medicine and the constant evolution of medicine, we've had to now learn how to advocate, how to strategize, how to speak up, where we should just be able to go into work and focus on the care of the patient. But there's such craziness happening in medicine that we've had to even step outside of those roles, risking sometimes our own security, because let it be said, you go up against the administration, you may lose your job.
I mean, and that's the truth. I mean, it's exhausting. As a midwife, it's like not only do I have to fight about midwifery and acknowledgement and understand that we're there, I got to fight as a woman. I got to fight as a Black Latina woman. Now I've got to fight for my patients in this way, not just for you to get good treatment and have a birth experience that you want. Even in the clinic, I mean, the clinic is all about seeing more patients, see more patients, see more patients. Nobody is like, well, this clinic down the street is seeing 30 patients a day.
And you think that's okay. My response is always like in your mind, that is logical and reasonable.
I mean, not only that, by half a day, if you're seeing that many people, most people don't feel like they got good care, right? And so they're angry at you because like, I felt like she was rushed. Yes, baby, she was rushed because she's got 15 more patients before noon. And I can only address this for you today. And so it's like, for example, I have heard that, even some organizations give incentives to their providers to see more patients than
yes, they do.
The cap. Not incentives for getting great care, for keeping your patients healthy, not incentives for like, you know what, you have a diabetic and I did all of your cards and you have been on top of it and none of yours have been hospitalized in the last year. No incentives for like your patients love you. No incentives for
no incentives that you brought down that A1C from 13 to 6 to 5.
Nothing.
None. Just how many have you seen? No incentives that, you kept patients alive despite their multiple comorbidities. Absolutely. But if you can run through and take care when she has high blood pressure, diabetes, and you just take care of the diabetes today and you bring her back next week to take care of the hypertension so you can bill twice. Exactly. No consideration for people not being able to take time off from their jobs to come in.
You want to know why you have to have so many visits, everybody? That's why. Because, they always think about you can only bill one day for one service. So it doesn't make sense for you to see the midwife or your OBGYN and the pediatrician for your newborn visit, but maybe you can do that day. So it's like, it is insane. And I'm sorry if we sound bitter, but it is exhausting.
No, I think it's, but this is what leads to the burnout, right? Because we're having to literally fight an entire system with multiple people, right? We're fighting insurance companies to make sure that we can get services covered. Then we're also having to fight administration because I need to take extra time with this patient because she just had a complication or a pregnancy loss, or something that requires time to really speak to a human being that had a tragedy in their life. The people who lose loved ones suddenly, that is the humanity of medicine. And because
that's what we got into it. We're
yes.
Here. I can't tell you how many times I've heard when they close midwifery panels in the hospital, the answer is it is an unsustainable model. Medicare does not reimburse well, so it is unsustainable to pay for a physician and a midwife. So guess what? The midwives are out. Never mind the fact that midwifery improves outcomes, saves lives, does all of these things that we know, brings in doula care, all of these things that we know, but it doesn't pay. So guess what? I mean, isn't that heartbreaking?
Yeah, it doesn't pay because you don't value the work, right? It's where you put the value on the work. And so there's fewer interventions, but if you're a for-profit system, then you want those interventions, right? You want
sicker people. Don't say it too loudly.
Did I say the quiet out loud?
Yeah, I know we're poo-pooing on the system and everybody, and that's like a thing. So it's not to say that there are not great providers out there. It's not to say that there are not people, and I will say this for most of us, because I have really not run into somebody who is not doing this work out of really feeling called to it. That is not to say that despite these obstacles, we are not out here doing amazing things every day. Listen,
Yes.
we are out here giving it our all. I've got 3 little ones. We're out here. Almost everybody is really out here trying to do good things. So it's not to say that we're like the whole system is evil. It's just what we are up against. I think people should know, because then people can make informed decisions, and people can support change that would actually positively impact them. At the
Yes.
end of the day, this would supporting providers, supporting a change in the healthcare system and how it works. Ultimately, really, you can feel it impacts you, because at least at one point in your life, you're going to be giving birth, or you're going to know somebody who's going to be giving birth. At one point in your life, you're going to have an injury and you're going to have to go into the system. At one point in your life, somebody's going to be sick and you're going to have to go in. And most of us do not have a private physician on call who will come see us at the house. Most of us do not have that type of access to healthcare. Most of us got to go through insurance or some other thing that it's like, God help me,
Yeah.
keep
Yeah.
me safe. So
Yeah. And so that being said, I completely agree with you. I think if we had to give individuals an action plan or a actionable item, the actionable item is to don't tune your ears out when it comes to healthcare policy. We have to be actively invested and we have to be actively participating in health policies. Really, what does that health policy mean to you? Going up against the hospitals, the reason why that hasn't worked is because the hospital staff are not the decision makers. So now we really have to, when we talk about the system being sick, we're talking about a very sick healthcare system. We now have to talk to and pay attention to our politicians, to our representatives, and are they paying attention to healthcare? Is healthcare at the top of their list? And if it's not, we need to make sure that they know that healthcare needs to be at the top of their list of concerns, and that we need to pay attention to what policies they're suggesting and understand how those policies are going to affect us. And if we don't understand, we should be able to ask those questions. How does that policy affect me? And that's what we're saying. That's the actionable item for everyone, is we have all got to be more actively involved when it comes to healthcare policies.
and I would break it down just slightly a little bit further, and maybe just ask yourself or write it down. What is your value, your core value about healthcare or humanity, right? If your core value is that everybody should have access, or everybody deserves, it's a human right to be taken care of. If that is your value, then you can look at other ideas and policies and beliefs and understand better, does that align with your core values? Does it align with, if we do this, is everybody going to have access to care? Maybe not. It may sound good for me, but it doesn't align with my values, so I can't go with it. And I don't mean beliefs, because people think beliefs and values are the same.
Right.
Beliefs are things that can change, and beliefs are what we think is how we should establish those values, like how you kind of get the values in, right? But your core value is the simple one. It's the one everybody deserves. It's a human right to be cared for. That is your value. Your belief is that maybe the best way to do it is privatized healthcare. That's a belief.
Right.
But if you know your value, then you may be willing to hear and understand different policies and understand and kind of see the pitfalls a little bit more easily if you are clear with what you want and what you believe should be happening. I think that's the first step. You got to be clear otherwise.
Yeah. Yeah. And some of you may be stumbling on whether or not you believe that everyone deserves that right to healthcare, but we go in right there.
That's my point. That is my point. It's time to look in the mirror.
That is the underlying issue right there. Okay. That being said, it's always great to have Olivia on the hot seat. Listen, because she makes the seat hotter, dropping them bombs. Okay, those knowledge bombs. Listen. We can go on forever. As you can see, we're both passionate about this topic. But Olivia, if they want to find out what else you're passionate about, where can they find you?
Oh man, you can find me at This American Midwife on Instagram. But if you really want to know, you could just DM me, slide into my DMs, and we can talk about it, because I don't post that much. I try to stay out. There's too many opinions.
Listen, we are gathering a coalition of people who are ready to make changes, okay? If you want to make changes, make sure you slide into her DM, because that's where she's at right now.
Let's collaborate.
Let's collaborate. Let's brainstorm. Listen, we gonna have to change, because we are the heart of medicine, right? So the heart of medicine should be the lead in this change for healthcare. That being said, I'm Dr. T, the hand behind the handle of Healthy Bump Club, right here on YouTube, and also the hand behind the handle of Healthy Bump Club on Instagram. And now you can find us somewhere. Fan base, as we grow our following there as well, because we support our own. That's right. We thank you guys for watching. We thank you for supporting us. And we see y'all in the next episode. And